Hey everyone, and welcome. We're about to jump into a topic that might sound a little intimidating, but really, it's all about the most basic, most vital thing we do every single second: breathing. We're going to demystify the tracheostomy and really understand how it helps people breathe easier. I mean, just think about it for a moment. Go ahead, take a breath with me. Inhale and exhale. It's this constant, steady rhythm of our lives, right? It's so automatic. Most of the time, we don't even notice we're doing it.
But what happens when that simple, effortless rhythm gets broken? When the path that air needs to travel gets blocked or just doesn't work right? Well, that's exactly where some amazing medical innovation comes into play. Okay, so let's get right into it. First things first, what exactly is a tracheostomy? The easiest way to think about it is creating a brand new, direct path for air to get where it needs to go. This diagram shows it perfectly. A tracheostomy is basically a shortcut for air. It bypasses the normal route through your nose and mouth and instead creates a direct, safe opening right into your windpipe, the trachea, so air can get straight down into the lungs. So, to put a more official definition on it, a tracheostomy is that opening, which is called a stoma, that's surgically made through the neck to get right into the trachea. And it's through this little opening that a breathing tube can be placed. So why would someone need this procedure? Well, there are a handful of really important reasons. It might be for someone who needs help from a ventilator for a long time. Or maybe there's some kind of blockage in their upper airway that needs to be bypassed. It can also help protect the airway if someone has trouble swallowing. And it makes it a lot easier to clear out mucus and other gunk from the lungs. Now that we've got the what and the why, let's talk about the how, specifically the equipment. Because once a tracheostomy is in place, there's a whole toolkit that becomes part of daily life.
The star of the show, of course, is the trach tube itself, and they're not all the same. Two of the big names you'll hear are Shiley and Bivona. Shiley tubes are made from a type of PVC plastic, and they're probably the most common ones you'll see. Bivona tubes, though, are made from a super flexible silicone with a wire coil inside, which makes them a better fit for people who might have some unique anatomy.
And here's another key difference: the design itself. On the left, you've got what's called a single cannula tube. But check out the one on the right. That's a dual cannula. The really cool thing here is that the inner tube, the cannula, can pop right out for easy cleaning, while the main tube stays securely in place. You can imagine how much easier and safer that makes things. This brings us to something that is absolutely crucial: sizing. This is not a one-size-fits-all situation, not by a long shot. The sizing is incredibly precise. We're talking down to the millimeter. Getting the size and length just right for each person's body is so important. Why? Well, because the wrong size can cause all sorts of problems, from discomfort to skin issues, or it could even block the airway. So precision is everything. Okay, so let's shift gears and talk about daily life with a trach. One of the biggest things to manage is the air that's actually going into the lungs. Specifically, keeping that air nice and humid. Our bodies are pretty amazing. Our nose and throat act like this perfect built-in climate control system. They warm up, filter, and add moisture to every single breath we take, making sure the air is just right by the time it gets to our very delicate lungs. But remember that bypass we just talked about? A tracheostomy skips that entire natural system. So the air going straight into the trachea is a lot cooler and way drier than the lungs are used to. And that can cause issues, like making secretions thicker and causing irritation. So what's the solution? It's this clever little device right here. It's called a heat and moisture exchanger, or HME for short. The best way to think about it is as an artificial nose. When you breathe out, it traps heat and moisture from your breath. Then, when you breathe in, it releases that warmth and humidity back into the air. It's a really simple but brilliant way to keep the airway healthy. All right, with any medical device, it's always smart to be aware of potential complications. But the key here isn't to be alarmed. It's just to know what to look for so that any little issue can be managed quickly and effectively. So let's start with a really common one. You might hear doctors and nurses talk about granulation tissue. So what in the world is that? Basically, granulation tissue is just an overgrowth of new tissue. It's kind of like scar tissue. It can pop up right at the stoma, that opening in the neck, or even inside the windpipe. And it's usually just caused by friction from the tube. It's the body's natural and pretty predictable response to a little bit of irritation. And the good news is it's very manageable. A lot of the time, treatment is as simple as applying a steroid cream to calm things down. If that doesn't quite do the trick, a doctor might use something called silver nitrate to treat the area. It's really rare for it to need anything more than that. The important thing is that there's a clear, straightforward plan to take care of it. Infections are another thing to keep an eye on. And what's really interesting is that the type of bacteria often depends on where you are. An infection you might pick up out in the community usually involves common bacteria, but infections that start in a hospital setting can involve different, sometimes tougher bugs. Knowing this difference is actually super important because it helps doctors pick the right antibiotic to fight it off from day one. And all of this brings us to what might be the most crucial point of all. Managing a tracheostomy is not a one-person job. It really truly takes a team. Check out this quote. It's from a major medical statement, and it shows something really telling. Even for a routine task like changing the trach tube, there's no single universal rule. Some places might do it weekly, others monthly, and that right there is the perfect example of why it is so critical to follow the specific advice and plan laid out by your dedicated medical team. And that's really the bottom line. Success isn't just about having the right equipment or a perfectly done procedure. It's about the system of care. It's that strong, coordinated partnership between the patient, their family, and the whole team of healthcare providers that truly makes all the difference in the world. So a tracheostomy opens a new path for air, but it also creates a whole new system of care and support. And that leaves us with a final thought to chew on. As technology keeps getting better and our understanding grows, how can we make these systems of care even smarter, even more supportive? How can we keep evolving to truly make breathing easier for every single person who needs a little help? Thanks so much for joining me.